We asked Daryl Orth of Northern Kentucky University to discuss his proposal to identify and benchmark the safety practices that are most effective in helping electrical contracting firms pursue the goal of zero incidents. Tell us a little bit about this proposal. I understand it involves measuring safety performance.
Looking at NECA contracting members, their safety record, as far as what their EMR ratio is, their incident reports, lost work days, costs that they're spending on workman compensation rates and insurance and other items related to safety, and trying to categorize them by their group as far as their residential, commercial, industrial. Then I believe they have the powerhouse by the different industries, number of worked hours they work per year, revenue that they do per year. So categorize them so they can kind of see where they stand at. Looking at different, like the incentive programs, training and orientation. If they do training and orientation, how often do they do it? If they do have an incentive program, what is it? What's it? Is it every 3 months, every 6 months? Is it only for the frontline supervisors, or for all workers, and job site inspections? So it's kind of investigating their safety program.
So what's the importance of this study?
There's several reasons, but I guess the one is they're trying to achieve the goal of zero incidents, where they have no accidents or fatalities. That's really being driven by the project owners, who require zero incidents, because if you do have a fatality or a major accident, it affects your productivity, your profitability, and then it affects your public image, your reputation. And that affects the project owner, but also it's going to affect the contracting member, and then you can also have schedule delays. But even if it's a minor accident, if it's a cut, scrape, you're losing productivity, you're losing profit, and it's affecting your reputation. So that's one of the importance of it.
If I'm an electrical contractor, what benefit will the results of this research have for me?
The benefit? Well, one is hopefully you have a lower EMR. If you have a lower EMR, your workman compensation rates should be lower. And with that lowering, you should have increased profits. If you have increased profits, you have increased productivity. Your absenteeism rate should drop, because it's been cited that workers do leave sometimes because it's safety. So if they have lower employee turnover, then they should have lower training costs. And then they can also help select what I call a safe partner. They can choose what subs they're going to have, what vendors they want to work with, and they can also help evaluate the general contractors and owners and decide whether or not they want to work for them. Make sure they're walking the walk, as they say, when it comes to safety.